My name is Ila, and I'm the CEO and co-founder of DIA, the leading provider of AI-based ultrasound analysis solutions. Our vision is to leverage AI to make the use and analysis of ultrasound images smarter and accessible to all, with our FDA-cleared and CE mark solutions. Let me take you on a journey through time, to the future of ultrasound AI.
The ultrasound market has transformed dramatically in the last few years. From huge and expensive devices to smaller and less expensive handheld devices. Ultrasound is the only image modality that expanded to new users at the point of care, including the emergency departments, ICU, military medicine, and home care. Yet capturing and analyzing ultrasound images are still done mainly visually. Such a process is subjective, error-prone, and highly dependent on the user's experience. There is a great need to automate this process. Let's hear what the physicians think.
We have tremendous variation in subjectivity in reading and even where is the endocardial border. So having an automated, artificially intelligence, quantifiable, defined ejection fraction as well as strain has the potential to really change the way we do echocardiography.
My first exposure to AI and ultrasound was via the Vivo EF. In my view, it's very similar to the psychological benefit of having sort of an automated EKG interpretation. As an internist, I'm constantly sort of doubting myself and being critical of my own assessments, so it's nice to have that sort of immediate feedback and support.
DIA's mission is to automate this process, providing Vivo Toolbox. Vivo Toolbox includes auto-analysis of cardiac functions, including automated ejection fraction, strain and segmental wall motion analysis, as well as right ventricle size and function. In addition, Vivo Toolbox includes bladder volume measurements. DIA has partnered with leading channel partners. The technology is cross-platform and vendor-neutral and can easily run on an ultrasound device near a patient's bedside, on a workstation, or behind the scenes on any healthcare IT system. Vivo solutions are available and serving thousands of end users around the world. You'll probably ask how to choose and trust AI solutions. Let's hear how key opinion leaders do it.
I personally trust that AI solutions can provide similar results to what I see. Once I see it and I see reproducible results, I really feel that it is a good solution and it should be adopted.
I think accuracy. I think it's very important to have a system that you know is going to be accurate, that the number they deliver is going to be accurate quantification. Seamless integration. It does everything behind the scenes. It can select the images. It can then present it literally within seconds, and you can see where the tracing is.
We understood that AI can be trusted if it's validated, reproducible, and accurate. What is the actual added value of using ultrasound AI in the Echo Lab?
The software we're talking about is fully automated. You do not place markers on the screen at the apex or the annulus. It is without human touch, so it's remarkable advance. But these measurements allow us to get a second opinion. The other advantage that we have in the Echo Lab is the software we're going to be using is vendor neutral. So we are not relying on a single machine or a single product. This software will actually measure these measurements in echo equipments that we use in our lab.
And now, let's hear Dr. Nelson speak about the value at the point of care.
So the novice users can use this as a way to have additional quantification and additional assistance as they build up their working knowledge and their pattern recognition for examination time after time. It's like having a virtual coach with you as you learn and grow.
Here's an example of DIA's strain analysis. How does AI help you to reimburse strain ultrasound analysis?
I think what you can see here is, again, this is an automated presentation, and the ability to apply this takes seconds. I think this was in real time, probably 1 to 2 seconds to perform the analysis. You can see the device touching it, and the analysis is almost instantaneous. And the strain imaging then is displayed in the bottom. This is a remarkable tool, and today it is reimbursed.
Being able to benefit and get reimbursed from using AI is wonderful. But when can AI really change patient treatment?
Right, so this was a case of a 79-year-old female patient who was admitted to our ED with complaints of cough, fever, and fluid overload. The patient was diagnosed with pneumonia, and as part of evaluation, she underwent a point-of-care echocardiography, which assessed her LV function to be significantly reduced. Subsequently, treatment with IV antibiotics and diuretics was begun. Within hours, the patient developed shock, and I was urgently called to reassess the patient and perform an official echo examination. You can see here the clips are acquired, and as you can see on the left, her LV function was normal, with normal size. However, when I assessed her right ventricle on the right, her right ventricle was dilated with reduced function. The patient did not suffer from LV dysfunction or pulmonary embolism, and upon fluid resuscitation, the patient recovered rapidly. Now, this is not a rare case. Mistakes like this happen on a frequent basis, and had AI been utilized, this mistake and shock may have been prevented.
This was an excellent example of how the use of DIA's automated LVivo EF and LVivo RV for both left and right heart analysis may have affected the patient's treatment by starting early treatment of pulmonary embolism and preventing the patient's shock. COVID-19 has accelerated the use of new technologies, workflows, and the acceptance of AI solutions such as DIA's LVivo Toolbox that has been in use on the front lines, helping to triage and monitor COVID-19 patients' heart.
COVID was a great pilot in terms of increasing awareness how AI can assist with diagnosis. So being able to assess cardiac contractility, ejection fraction rapidly is really important. So an AI-driven tool like LVivo is going to really improve the ability for people to rapidly triage and evaluate patients.
Right, so briefly, this was a case of a 66-year-old COVID-19 diagnosed male who was presented to our ED with complaints of atypical chest pain and palpitations. His ECG revealed non-specific changes, including T-wave inversions, and the patient was evaluated using the VScan Extend and the LVivo EF. As you can see here in the clip, basically the examination demonstrated immediate results of normal ejection fraction and normal function of the left ventricle. So the results supported the ED physician's conclusion that myocardial infarction or ischemia can probably be ruled out, and significant virus-associated myocardial injury was an unlikely option.
Our journey is close to an end. We talked about the past and the present of ultrasound AI. What about the future?
I mean, I think that at this point, the highest value currently with AI and ultrasound is when you form your own clinical judgment first and you commit to it mentally, and then you sort of switch on the AI. As I like to make the analogy of airline takeoff and landing systems and autopilots. So when you have the initiation of autopilot, it's the primary function is the autopilot's there for backup and the pilots are there for primary. And now over time with acceptance, you have the autopilots being primarily on board, and then you have the pilots there in case the system goes wrong. And I think with AI and ultrasound, that's sort of where the future will lead us. Right now it's the backup, but in the future it will probably be sort of the primary.
Indeed, the future of ultrasound AI looks promising, but there is a lot of work ahead of us. If you're an ultrasound vendor, PACS company, or a medical center that would like to make a real difference in patient care, we invite you to join our journey to make the use and analysis of ultrasound images smarter and accessible to all. Thank you for watching.